Hi, welcome to the Always Evolving podcast. I'm your host, Dr. Elizabeth Fedrick. Today, we're delving into a topic that touches the lives of countless individuals, coping with a cancer diagnosis. This journey presents profound emotional, physical, and practical challenges for both the individual diagnosed and their loved ones. And joining us today is Kim Virrueta, a therapist who specializes in cancer and chronic illness counseling. Kim is here to offer us some insights and strategies to navigate through the complexities of coping with cancer, as well as providing support and guidance to those facing this difficult journey. It's okay that we don't have it all figured out. We're all just taking it a day at a time. This is Always Evolving with Dr. Liz. Hi, Kim. Welcome to Always Evolving.
Hi, Liz. Thanks for having me.
Yes, thank you for being here. Tell everyone who you are, what you do, what you specialize in.
My name is Kim, and I specialize in treating patients and families who are going through a cancer experience or chronic illness, or maybe even the grief that comes after losing a loved one. I have a background in child life as well as child and adolescent development, and I kind of approach treatment from a medical family therapy model. So it's kind of combining all of those things together to help address the specific issues that this population deals with.
Yeah, and the specific issues are so specific. They are
hmm
so unique to this population in terms of you you can't prepare yourself for that, and you
Mm-mm.
can't prepare yourself to hear that about a loved one, and your brain just starts racing and goes to all the worst places. Tell
Yeah.
us, what are some of those experiences like when you're working with your clients, whether it's the emotional, the physical, all of those experiences that start to pop up that you really can't prepare yourself for?
Yeah, absolutely. The way that I approach everyone is from a biopsychosocial, cultural, and spiritual perspective. So I'm looking at all of the facets of the whole person. Really, the big thing that happens initially is shock and denial, and that is the part for many that they can get stuck in. So, what I try to do is help them through that by directly addressing kind of the biological and nervous system level issues to start with, which is just, your body, your mind, everything goes into survival mode. So
Right.
we want to try to get them back into a regulated state of nervous system. We want to help them get grounded back into their body. And we also want to make sure that they are meeting their basic needs for food and adequate, nutrition and sleep and staying hydrated and things like that.
And for the let's say partner or the caregiver, the loved ones that are involved,
hmm
what does this often look like for them? Like, what are some of their experiences, and how do you help equip them to manage their own emotional response while they're also trying to do this caretaking?
Yes. So there are a lot of different ways to approach this. I think the best way to do it is to know when to ask for help. That is the thing. I see a lot of caregivers, think that they can handle it themselves. They don't need extra help. They don't want to burden anybody else. The patient often feels like that too. Like, no, don't ask mom for help. Don't ask so and so. So really knowing when to ask for help, because when help comes in, it's like now the family's able to continue on with somewhat of a normal routine. There is help with, meals and chores around the house and all of the things that need to be put on the back burner when you are focused on, trying to save your loved one's life, save your own life. So that's really what I think is important during that time, and a lot of self-care.
Yeah, absolutely. And asking for help, as you're describing, can be so hard. And it can feel like, no, I got this, I got this. But the toll that it takes physically and emotionally, mentally,
Mhm.
and then if you add in all the other elements, if you're trying to still work a full-time job, or if you have small children,
Yeah.
it can be so overwhelming. And even when you're talking about self-care, what has been some of the most effective approaches that you can either get people agree to, or that they have seen actually be helpful for them through this process?
Yeah, that's a great question. I think when someone maybe says you need to practice self care, it can feel very daunting. Like, I don't have time for that right now, or I don't have the mental capacity to do that. And so, what I like to do is help them to understand that self care is the little things. It's not like, okay, you need to plan on doing A, B, or C every day for the next, for your treatment duration or whatever it's going to be. It's can you practice good sleep hygiene for 10 minutes before bed? Can you take 15 minutes to do some deep breathing and listen to some music that's comforting for you? Can you go out in the yard and sit in the sun for 5 minutes and just breathe in the fresh air and get really grounded to what you're seeing and hearing and feeling and smelling? Like those are the things that really make a big difference. And so I think when we can get back to those real small basics, it makes a massive difference in their well-being overall.
I agree. And thank you for clarifying that, because I think that's a really important for a lot of people to hear, is that
Yeah.
self-care does not always have to be these extravagant or these lavish or these time-consuming things. It can really be just taking a few minutes to breathe or drinking water, whatever that is, just to take care of your body. What
Yes.
is usually your approach then? So when you start working with a client and they just got this news and or maybe they've had it for a while and they're having a hard time even accepting it. You talked about them getting stuck in that first stage. How do you help them navigate and move through that?
Yeah, great question. It's really going to be two things. It's going to find out what kinds of things are they trying to control.
Mm.
So those are the things that, sometimes if we can identify you're trying to control some things that are completely out of your control, this is going to cause a lot of distress because they're stuck in this kind of black and white thinking. So I try to get them to kind of build in more flexibility into the way that they're seeing their life right now. This is a down in life. Yes, and there are a lot of things that aren't in your control, but what are you in control of? Like now you might have more time because you are on medical disability from work. So what are you doing with that time in order to create more meaning, more
Yeah.
memories with your family, getting really kind of recentered on the things that are important to you? So it's a really good time for people to rediscover their values
Hmm.
and make more of a life that is full of joy, full of the things that are important to them, rather than just kind of living day by day and kind of going through the motions like some of us get into, the habit
Yeah.
of doing as we get busy.
Yeah. A lot of us, quite honestly. And
Yes, me too.
yeah, I like that reframe of r- it's saving room for the and that this is a horrible, scary, overwhelming time in your life. And it's also an opportunity to get back to some of the basics and to find joy in the smaller things and to really appreciate your family and those relationships. Do you generally see that people can be receptive to that, or what do you see as a barrier when you're trying to do that work?
It's usually something that is, accepted by them. Sometimes it's hard for them to get into that frame of mind because they're so stuck in, what is the worst thing that's going to happen? This is what I'm set on as being a fact. And so, we might be able to reframe a lot of different things, but the bottom line is it's uncertainty and they don't know how this is all going to work out. Right.
Yep.
And so helping them to get back to the present moment, a lot of mindfulness used in what I do with people. I can hear them going into, fear of the future mode and all of these other things and the what ifs, right? The what ifs
Mhm.
are really difficult.
Yeah.
So just helping them to kind of get back to the present moment and finding safety in the present moment because the future feels very unsafe for them. And so, yeah, that's something that kind of helps me to help them to understand that what is in control is the present moment. So that's kind of how I help them get that buy-in.
Yeah, which yeah, that's great. That grounding and even sometimes just even the little mantras of like, in this moment, I'm safe. In this moment, I'm
Yes.
okay. Everything around me is okay. And
Mhm.
that doesn't take away the fear from the future, but it does allow us in that very moment just to regulate and just to let our body just have a little bit of ease in those moments of anxiety. And
Mhm.
the continuing to do that work as they're processing through and as you're saying, focusing on the present moment. But is there work that you do around them preparing, whether for the future or preparing for the unknown? And what does that look like?
Yeah, absolutely. It depends on what someone's diagnosis is. If they are terminal, then we're dealing kind of with, legacy, right?
Mm.
What kind of a legacy do you want to leave your family? What does it look like for you to die well, right? What does it look like for you to tie up loose ends and figure out how you can build in as much meaning and fullness into the life that you have left and really finding joy in that. And of course, that's a process. I make it sound very simple as I'm just explaining it here, but
Sure.
it's a process. And so, yeah, trying to help them to understand that whatever it is that is coming up ahead, they are equipped to handle that as it comes. They may not be equipped for 3 months from now, tomorrow, but wait until that comes and they will get to that place, right?
Yeah. Yeah. And I love that because that you are simultaneously keeping them in the present while preparing for the future. So yeah,
Yes,
that grounding, really helping them to be as much as they can uh regulated in this moment so that they can feel more
yes,
prepared for what's to come. Kim, this is
absolutely.
such helpful information. I appreciate you so much. Where can people find you and find more information about you?
You can find me on Instagram at Therapy with Kim V. And then I have a website as well, therapywithkimv.com.
Well, thank you again for being here. I really appreciate
Thank
it.
you. Thanks for having me, Liz.
Absolutely. Thank you again, Kim, for joining me today. And thank you all for joining us on the Always Evolving podcast. Please make sure to rate and review. And you can also subscribe to our newsletter by visiting our website at www.evolvecounselingaz.com. You can also find me on Instagram at Dr. Elizabeth Fedrick. This is Always Evolving with Dr. Liz.